people insured by BlueCross BuleShield Tennessee could no longer be in network with Summit Medical Group after it said it's been unable to reach an agreement for an updated contract.
Summit tells us it's in a formal notice to the health insurance provider informing it of the non-renewal, which would go into effect on January 1st.
And while the negotiations continue, 6 on Your Side reporter Naomi Hilmer talked with people who are worried about their future access to health care. Naomi.
Lori Bowe, in talking to people who are insured by BlueCross BuleShield, they tell me there are a number of ways this could impact them. For many, they say this puts them in a situation to either continue using BlueCross BuleShield and go to another practitioner, or they would have to find a new insurance or pay out of pocket to see the same people they've been going to for years.
I'm terrified of what could happen if we have to change.
Christina Schwartz says she's been going to the same doctor for years, but if Summit Medical Group becomes out of network for her, she's more concerned about what that means for her son.
He's on Medicaid, disability insurance. He's on the better one that everything should be able to be covered. And it's going to be are we going to be able to get this covered? Are we going to be able to get him help?
She says her 17-year-old son, Caden, is on the spectrum with a long list of medical history. And despite the fact that he will not see a new doctor, she's also concerned about having to start back at square one.
I don't know what I'm going to do because I'm going to go into a little bit of a panic because it's going to be hard for him to switch. It's just makes life really difficult for kids like Caden.
As someone who has been on other insurance, she says Blue Cross is the best option. And Megan Hazelschwart agrees.
BlueCross BuleShield has been a better insurance provider for us, but I think we would rather take the hit of not having as great of insurance than we would having to unravel all of our medical care and find new people.
Hazel Schwart is in a similar situation, with 2 of her kids being diagnosed with autism last year. But she says even if she were to change practitioners, they could lose out on health care.
Ultimately result in a lot of people losing access to their medical care just because of the amount of time it would take to reestablish new care.
And Schwartz says she's concerned making any switch, either with insurance or with her practitioner, could keep her son from being treated properly.
Because most likely, if they don't come to a conclusion, they're also not going to give us resources to help us to find the next thing that can help us. And so that's what I'm afraid of.
While Summit Medical Group is not planning to renew at this time, it said nothing changes for patients right now, and they should continue to seek care with their Summit providers as they normally would.
Naomi, thank you. In a statement from BlueCross BuleShield, it also reiterated there is no immediate impact to people's abilities to see their Summit providers and that it remains committed to working toward a resolution.